So one of the things, which says in my the title of my presentation also is enabler, and I've heard this thing a few times since yesterday, that technology is actually a big enabler for us. And it's very interesting to know, and to just see how many different ways technology actually enables, and how many different stakeholders within the whole healthcare ecosystem get enabled if we use technology appropriately. So I have a very special and a very interest in this particular topic because of my own personal experiences and background. I'm a doctor, I'm a surgeon by training. Used to practice surgery at All India Institute of Medical Sciences earlier. And I worked at a tertiary care trauma center in the northern part of the country, which probably was the first major center that came up in that part. And if I look back 10 years back and see how we actually delivered trauma care in that setup, I feel that we have come a long way since then. We are now much better equipped to provide the kind of care that we should, thanks to technology. And as I go along, I like to touch upon two things. So the title talks about the evidence-based clinical decision support and for physicians. So what is so different? Why these two things that I picked up for this discussion today? What's so different about a physician today? And when I say that I was a different physician 10 years back, maybe some of you are much more experienced and you have seen a life of physician even prior to that. So what's so different? To me, one of the biggest differences is actually the amount of information that is available. While it's good to have all the information, and somebody mentioned yesterday that the more the information that's available, the better it is for us. Probably true in certain contexts, but I don't think that's always the case. Sometimes the amount of information that is available can actually be overwhelming, confusing, and misleading to anyone. This is what happens in the information era, and I think my physician colleagues in the audience would be able to relate to that. We oftentimes get to see patients who know everything about the disease by themselves. The thing is, they have still not done anything about it, and that's why they are here. So they're not here to know more information from me as such in many cases. What they want me to tell them is, what is it that they should do now? So that's where the art of decision making becomes very, very critical. And I see technology as a big enabler in making those decisions for physicians, for patients, for their families, and policymakers, for everyone. So what I mean to say is that from an era, maybe 20, 25 years back, where there was relative paucity of the information, the relevant information, we have come to a place where there's so much information all around us that it's difficult sometimes to make sense of it. And that's where technology comes to our rescue. Before getting into the healthcare bit, just to give an example of, we all need decision support systems in our lives every day. The simplest decision support system I use almost every day is Google Map. When I'm driving from my home to my office, I try to figure out what's the most effective way to reach the office today. And there are certain things that come into the decision-making process. This is how we arrive at decisions, right? So we need data, information, knowledge, wisdom, and eventually when we synthesize everything, then we arrive at a particular decision. It's not that I don't know the way to the office. I do. I know quite a few of them. What I don't know is how is the traffic situation on those different routes today. What I don't know is there a vehicle breakdown on one of those routes today? What I do not know is that is there a major demonstration happening on one of those routes? I do not know whether this whether there's some other kind of obstruction on the way. So that's where I need a decision support, and I need support from somebody or something that can help me understand what I do not know. So while I may have all the knowledge about things, I don't always have all the information. Or even if I have information, I may not always have the wisdom to make sense of that information and that knowledge. And that's where decision support systems play a role. The industry we all look forward to, healthcare talks about airline for many reasons, and I think rightly so. Because airline industry is one industry which has actually mastered the art of decision making. A pilot flying 30,000, 35,000 feet in the air knows exactly where to land the aircraft. If as a surgeon I would know exactly what to do in a patient about whom I don't know everything about their genetic makeup, I don't know everything about their past history, I don't know everything about their family history, even they don't know at times, and still we have to make decisions. how do we make those decisions? In airline industry, the pilot doesn't know where to land when they're flying so much high, but they have all the support systems in place which synthesize the information, data, knowledge, and everything, and help them, land at a certain place. So that's the art of the decision making, which we want to bring to healthcare. And a critical element there is to actually acknowledge that in complex situations, machines can help us make better decisions, and we have to leave our, as physicians and healthcare providers, we have to leave our egos aside and actually start believing that in complex situations, we need somebody or something to help us analyze information, data, and then make a decision. So what do we want to do? We want to increase the value of the healthcare. That's a very, very simplistic and high-level view. But what does that mean? That means that we have to increase value by increasing the quality of the care that we deliver, by reducing the cost of the care that we have, possibly both. And if we are able to do both of them, then we live in an ideal world. And what does that mean is, then we have the patient outcomes improve, the cost of care goes down, and the patient throughput improves because the efficiency of the healthcare providers and the healthcare systems itself goes up. How do we arrive at that? What stands in our way to do that? We have been trying to do that for years, and everybody around the world is trying to do that. The thing is variability. There's so much variability in the care. In our country, in my own experience, every physician is an expert, every surgeon is an expert. I know exactly what to do. I know exactly what the next step should be, and that is what the problem is. I may know everything, but is that the best thing to do in that given situation? In that given complex situation, it may or may not be. My practice may vary from my colleague's practice. I know what exactly to do. I give a particular order. My colleagues in the hospital don't really execute the orders the way I want them to execute. So nursing staff may not interpret my orders the same way as they should. So the way to reduce the variability is actually to bring in a decision support system. And it's almost common sense, to actually understand if we are able to reduce the variability in care and make the decisions supported by evidence, supported by data, supported by all the information and analytic tool and big data and everything. If we are able to reduce the variability, we are going to increase the value of the healthcare. And for that, there are a lot of data that is already available. We all know about the medical errors. I heard the conversations in the patient safety conference yesterday. We lose patients, there are accidents, there are all kinds of misses and near misses happening almost every day. And we can look at reducing all of those. And if we learn a lesson from the airline industry, very popular book, If Hospitals Could Fly. I wish they could. I don't think they will ever, but we have drones now, but still they'll just be an enabler in the whole thing. The care will be delivered at the ground level. So what I'm going to actually show here very quickly is some of the options that we have which actually help us reduce in the variability, and that is what we call a clinical decision support. So from decision support, now I'm going to get into the clinical decision support. Now what does that clinical decision support actually mean? It simply means making clinicians better decisions, providing them support to make better decisions at the point of care. And where does that come from? All the data that the patient brings in, all the information that we have from the previous experiences of physicians and other treatments that have been delivered, the information we have about a particular geography from the hospital's own previous data. So all of the data, information, everything comes together, and we make a clinical evidence-based decisions. So we have guidelines which are based on the previous experiences, but the tricky thing about guidelines is that not all guidelines are always are easily applicable. And when a patient comes with diabetes, for example, I may have a guideline for management of a particular infection, and I may have a guideline on management diabetes. I may have a guideline on management diabetic foot. But what if all of this comes together? When I'm actually advising something to the patient at that point in time, all of this needs to come together, and that's where it becomes a complex decision, and that's where we need technology to come to our rescue. It's important to also mention that the CDS is not synonymous with EMR. EMR is just the, or HIS or EMR, it's the whole platform within which CDS is the component that helps us make the decisions at the point of care. So they're not synonymous, but they go together. How do we ensure that the physicians actually use it? A couple of times since yesterday, we have seen physicians are averse to technology, not very prone using EMRs. We actually have to make EMRs meaningful for them, and they want to deliver care. They don't want to do the administrative stuff. So by using all those new SNOMED, we heard about SNOMED, we heard about the design aspect of the EMRs. But if we are able to provide the evidence and the tools and techniques to make better decisions to these physicians, they will eventually use it. We have to give them a reason to use it. And the last bit before I finish off, I'll say is they also help us make further studies. They help us conduct further research, because if we have the data and information at the point of care, we can use it to actually learn how to make better decisions going forward. Elsevier, this is my sales pitch in the end, just a few more seconds. We are world's leading provider of decision support systems for doctors, for nurses, for all the healthcare providers, which are linked to the world-class evidence. So, and they are very easy to use. Some of them are actually usable using simple APIs in any existing EMR that a hospital has got. So I'm available. Some of my colleagues are also here. If you want to have more conversation on this, we'll be around and we'll be happy to talk about it. Thanks so much.